Now, it's very important, okay? Baruhin mo natin ha. Si Philhealth ho is basically just an insurance. Okay? So, definitely malinaw yan. I'm pretty sure alam nyo rin. Now, but this is, I want you to understand that si Philhealth ho, they are not health experts. Okay? Linawin natin ha, hindi ho sila expert, okay, sa health. Okay? They are not also a health regulating body. Si DOH ho yan. Okay? Next, ano pa ho? Insurance lang talaga sila. In fact, they are not experts on how to operate a hospital. Okay? And basically, isa pa, they are not experts in running any business. Kasi ho, insurance lang talaga sila. I want you to understand, kasi ho, ang pagpatakbo ho ng Philhealth is just basically insurance lang. Now, many of the hospitals see Philhealth as something more than an insurance, but mind you, actually insurance lang ho sila. Okay? Now, here's the thing. Dahil insurance ho sila, meron silang pera. So basically, ang business model ho ni Philhealth is that the product is all about providing insurance benefit or benefit in terms of health benefit. Okay? Now, since kayo ho yung magki-claim, dahil insurance lang sila, basically napaka-simple lang ho. Okay? They will require you to submit forms so that mabayaran ho kayo. So, ganun lang ho ang kwento dyan. Okay? Now, what is very critical is dapat maintindihan nyo ito. The impact of engaging sa isang insurance, lalo na si Philhealth. Now, because there is this engagement ho, okay, the concept is that it will basically lead to an improved financial management, okay, para sa hospital. Now, of course, depende ho yan. So, hospitals must adopt more rigorous, okay, financial planning for better predictability of the income. That's number one. Ito. Now, since you are engaging with Philhealth, ang mindset ho ninyo is ganito, compliance and standardization. Okay? Kasi, yun, insurance sila. Hospitals must ensure strict adherence to the guidelines and rules to avoid rejection. So, malinaw ho yun ha. Dapat susundin ho ninyo yung mga rules kasi sila yung insurance. Kapag hindi ho nasunod yung mga rules at yung mga standards, hindi ho kayo mababayaran. Okay? That's the second, okay, thing that you need to understand. Now, as an insurance, so it's very critical that you also understand that insurance organization, okay, are compelled to do, okay, risk mitigation. Okay? Now, ano ho yung risk mitigation sa end ng Philhealth? Ang dami ho. Okay? So, hospitals must align clinical aspects with insurance coverage to ensure payment. Yung risk mitigation ho ni Philhealth is that meron siyang mga rules na kailangan sundin. Sa part ng hospital naman ho, you need also to do your own risk mitigation. Okay? Because you need, since you are asking for payment, okay, you need now to align yung clinical aspect. Okay? Yung clinical aspect, okay, in managing the patient, all about it, and you need now to align it or balance it with the coverage. Ano ba yung coverage or ano ba yung mga requirements ng insurance? Okay? Philhealth has their own risk mitigation and hospitals need to have their own risk mitigation. Okay? Ito, your engagement with Philhealth as an insurance, okay, will have also an effect on clinical decisions. There is this administrative burden. Dapat ho maintindihan ng hospital, dapat ho maintindihan ng mga decision makers ninyo, okay, wherein engaging with Philhealth, okay, brings about increase in administrative work because the focus is ensuring ho yung compliance to the rules. Okay? So, dadami ho yung admin work, dadami ho yung documentation, dadami ho yung mga bagay na hindi naman talaga trabaho ng hospital, pero napipilitan ho kayong gawin ito because, okay, simply because you are engaging with in the insurance. Okay? And this one, the vulnerability to policy changes. Okay? Hospitals end up again in a problematic state because hospitals are reliant on policies. So the tendency here is the vulnerability of policy changes, okay, will directly affect yung operation ng hospital. It creates operational disruption due to changing of policies. Okay? So for example, ito, when Philhealth implemented CF4, everybody is now required to make a CF4. So hindi ho yan that's something new for the hospital. So many hospitals hired people to do the CF4. Other hospitals, okay, were forcing their residents and doctors to make the CF4. Okay? Because kung wala mong CF4 or hindi maayos pagkagawa ng CF4, hindi mababayaran. Now, so again, si Philhealth ho is insurance. Okay? Ang business niya or ang business model niya umiikot lang ho doon. Okay? So, hindi ho siya health expert. Okay? So when we talk of clinical practice guideline, when we talk of managing patients, the ideal way of managing patients, treating patients, hindi ho yan linya ni Philhealth. Kasi insurance lang siya. Okay? However, Philhealth needs, okay, to use some clinical practice guidelines for that. But take note, Philhealth, okay, has no business in making a clinical practice guideline. Because they are not allowed, they are not the experts on health. Kasi nga, insurance lang sila. Now, if you can see the slide, okay, the engagement of your hospital to Philhealth, okay, always bear in mind, ito, there will be improved financial management. Mapipilitan ho kayo, okay, because you can because of the need for reimbursement, you need to follow rules. Okay, which is related to the compliance and standardization. You are now compelled to adhere to the guidelines. Okay? At the same time, you need to make your own risk mitigation and that you need to ensure that meron hong coverage para mabayaran ho kayo. And you also need to consider that at times, no, the clinical decision of the doctors will matter, but it is highly influenced now by the insurance. Kasi kung hindi ho babayaran ng insurance, a lot of hospitals will not do the procedure or will not do, okay, the required modality or the required procedure or lab exam. And definitely there is administrative burden. Okay? Dahil dadami ho, meron na hong mga mag-i-encode, mag-hire ho kayo ng additional na tao, etc. Okay? And basically the vulnerability on policy changes. Okay? Take note, ang changes ho ng policy ni Philhealth is napakabilis. The policies that were out 2 to 3 years ago, at times, okay, napapalitan ho yan agad after few months or after a year or so. Okay?